Hi, my name is Melissa, and I'm excited to share my work on how mindsets are related to the outcomes of biomechanical interventions, and more broadly, how we can leverage psychology to help improve the efficacy of and adherence to biomechanical interventions. First, I want to introduce the psychological construct mindset. Mindsets are core assumptions about the nature of things and processes in the world that orient us to a particular set of attributions, expectations, and goals. Mindsets influence what we pay attention to, our affect, so our positive or negative emotions, our behavior, and our physiology. You may be familiar with mindsets about intelligence, well known as fixed or growth mindsets, but there are also mindsets about health. For example, one study found that informing hotel housekeepers that the amount of activity they were getting in their daily work satisfied recommendations for a healthy lifestyle led to higher perceived amounts of exercise, but also weight loss and a reduction in blood pressure, without an objective increase in physical activity. The relationship between mindsets and biomechanics is unknown, but this study presents a first step towards better understanding this relationship, so we can understand how they influence each other, and together how they both influence health. In this study, I measured the mindsets of people with osteoarthritis in a gait retraining intervention. 26 individuals with knee osteoarthritis completed 1 year of personalized foot progression angle gait modification aimed at reducing knee loading. We calculated the reduction in pain as the difference in the 10-point numeric rating scale between the beginning and the end of the study. At the end of the study, participants' mindsets about illness were assessed with the Illness Mindset Inventory Summary Score. We calculated Pearson's correlation coefficient between these two variables. The Illness Mindset Inventory Summary Score is a composite score of 6 questions that are part of a larger and validated mindset survey. It is scored from a 1 to a 6, where a 1 signifies a less adaptive mindset about illness, and a 6 signifies a more adaptive mindset. In the case of a less adaptive mindset, someone might be thinking, osteoarthritis has ruined my life, it is only going to get worse, and it's out of my control. On the other hand, a more adaptive mindset might present thoughts like, osteoarthritis can be challenging at times, but there are things that I can do to manage it, to live an active and fulfilling life. While these are not direct quotes, they are some of the words and language that people with osteoarthritis have used when I've asked them how osteoarthritis has influenced their life. Now I will present the results of the study. Here's a scatter plot of the change in pain over the course of the intervention versus the illness mindset score. You can see that a larger decrease in pain, so a higher reduction in pain, is correlated with a higher or more adaptive illness mindset. And this is consistent even when controlling for whether the person was in the intervention or the control group. I also want to show the results of another survey study in people with osteoarthritis, where we asked people how they managed their osteoarthritis symptoms in an open-ended question, and then measured their mindsets about the process of being physically active, which captures how much they enjoy or dislike being physically active. This is the plot of the measured process of exercise mindset on the y-axis, where again a higher score is more adaptive. And on the x-axis, there are 3 different responses for how people manage their osteoarthritis. On the left is with pain medication or injections, but without exercise. In the middle is both with pain medication or injections and exercise. And on the right are people who responded that they manage with exercise but not pain medication or injections. And you can see that those who manage the disease with exercise have a much more adaptive mindset about exercise than those who use pain medications or injections. It's also interesting to see that those who use both exercise and pain medication injections also have a significantly higher mindset than those who use pain medication or injections alone. So what are the takeaways? In these studies, I found that mindsets are related to outcomes of biomechanical interventions and an individual's chosen management strategy. But it's important to note that these studies are cross-sectional, and future studies should be longitudinal to evaluate causation and use more objective measures of physical activity and function. As biomechanists, we should be aware that what we are saying and what we are doing influences mindsets, and be careful not to shift mindsets throughout the course of a study. For example, if a patient's pain and function does not improve, this may lead to a shift in mindset that's less adaptive. To counteract that, we can mention that there may be other management strategies that may work for them, or help them recognize the other benefits they got from the intervention, such as getting more exercise. It's important not to let mindsets shift to something that's less adaptive, because this can have negative health consequences downstream beyond the study itself. On the other hand, and more positively, improving mindsets may increase the efficacy and outcomes of technologies and interventions that we're developing. This may be particularly beneficial as we go to translate our interventions into a clinical setting. We can leverage mindsets and, more broadly, psychology to help people reap the most benefit from movement. Thank you to my co-authors and collaborators, the support of the Neuromuscular Biomechanics Lab and the Mind and Body Lab. Thank you for listening. Please feel free to reach out with any questions, comments, or opportunities for collaboration.